oral health is to create innovative partnerships and sustainable strategies to increase oral health equity and improve the quality of life for all people in the North Sound region. All right, so welcome everyone to our first meeting of the LIN in 2024. My name is Lisa Soni, and I am the network manager for the LIN, which is a partnership between the North Sound ACH and the Arcora Foundation. And you can go on to the next slide if you want. We have some great items in our agenda today. So just to kind of walk you through it real quick, we're going to take a little journey through time. So we're going to start with some 2023 highlights, and then we're going to move into the present time for some legislative updates. So what's happening in the legislature right now? February is National Children's Dental Health Month. So we'll have a little program highlight on the ABCD program. And then we're going to look towards the future of what 2024 will hold. And then we'll have kind of our last presentation will be a new mobile dental program here at the Whatcom County Jail. And then we'll wrap up our meeting. So let's go ahead and go to the next slide. And while we're doing that, please introduce yourselves in the chat, your name, pronouns, title, organization, so we just kind of know who is in the room. Okay, so 2023 outcomes, and I always love putting together outcome slides because it really helps you, move out of the day-to-day where you're just like toiling away at your computer, and you get to kind of look at this snapshot and say, oh, we have indeed accomplished some things this year. So what I'd like to do is just kind of break down some of the things that we were able to accomplish in 2023. So the first two areas here were really driven. Each year we do a network evaluation. And so they were really driven by feedback that we received from those of you who participated in our network evaluation. So one of the things that we did around the theme of communication was really focus on developing kind of like a brand for the LIN, so it would be more easily recognizable out in the community and lend a bit more of a professional air to represent our network. And from there, we launched a bi-monthly newsletter. And this newsletter is really fun to put together. It is a pretty easy read, just a little one-pager that has little snippets of information that includes like what's happening locally, information in the general oral health landscape. It also has links to webinars and articles and other resources. So if you don't already receive it, I highly suggest it. And later today, you'll get the opportunity to sign up for it if you haven't already. And then another thing that we really did to kind of elevate the presence of the LIN was we were able to develop a web presence. So on the North Sound ACH's website, the LIN now has its own section, and here is the link to there. So if you ever want to learn more about the LIN or share information with others about the LIN, now you have a public place that you can go to do that. So that is really exciting. We also undertook some structural changes to the LIN in 2023. Last year, we talked about recalibration a lot, and that was really, if I could say, the theme of last year. And so there were two primary areas where we saw those structural changes take place. The first being that we really expanded our evaluation practices. And so later in our meeting today, you're going to hear all about that. But one of the things I'll just tell you right now is one of the great parts of these evaluation practices where we are now working with a person by the name of Lara Welker. And if you know her, she is a wonderful person. And if you don't, what I can tell you is that she has a soft spot for oral health, which is to our benefit. And she lives right here in Whatcom County. So she's been so great to work with. And she's got all kinds of great plans for the LIN in this coming year. And then the other thing that we really looked at, so the LIN is now moving into its 4th year. We're very, like, I would say, mature in our development. And so we decided it was time to change our structure a little bit. So originally we had a steering committee that was very essential to standing up the LIN, selecting anchor strategies, deciding on the initial strategic direction. But at this juncture, what we really started to see and hear from those members is that they really wanted to focus on how do we bring more services into our communities. So at the end of 2023, we decided to sunset that group. And later, we're going to share our ideas with you around how we hope to move forward with some more targeted, subject-based, and inclusive, open to more people work groups in the future. So that's kind of like the business end of the LIN and what we accomplished on that side. And so now we'll move a little bit more into the project side of things. So in 2023, despite 3 years as a LIN, we were actually able to fund our first workforce project. And workforce is one of our anchor strategies. And so that was really exciting. And it was with Bellingham Technical College. And so in case you don't know, going to school to become a registered dental hygienist is a very costly endeavor. Up front, there's some costs around like $20,000 just to purchase the equipment for the program. And just due to the structuring of student loans, it can be a real barrier for students if you don't have out-of-pocket money to pay for those. And so we were able to fund student equipment kits so we could take that barrier away. And the project's not totally finished yet, but we have really helped, or BTC, Elisa did all the work. Obviously, we just helped with the funds, but really help kind of eliminate that barrier for students and get them like in the classroom ready to learn and work right off of the bat. And proudly, I will also say that the ACH itself also matched the LIN funds to make this project happen. So it was a nice win for us. Another win in 2023 was Arcora has a program called Mouth Matters. It's focused on dental integration. Madeline Caplow is the project manager or program manager for that program. And she trains health professionals on oral health. So general oral health, linkages between other chronic diseases and so forth. And we'll show you a little bit more about that program down the line here. But the LIN itself was able to make some connections in the community and transfer those over to the Mouth Matters program. So I think the number is about 45 medical professionals were trained with that referral from the LIN in the Mouth Matters program, and have a greater understanding of oral health. So that is just a wonderful win as well. And the last thing I want to mention, I'm really proud of this, is that the LIN commissioned for the first time a report. And this one was the mobile dental feasibility study. And you will see this as we go through today's presentation. Serving folks who have traditionally been left out of oral health services, both just like in an urban perspective, but also and primarily in rural environments, really need alternative methods to connect. And mobile dental is really proving to be a strategy that can really help with access over time. And so this study, which Lara is how we kind of began our relationship, put together for us, and we'll put a link in the chat for you if you would like to take a look at it. But it, was that first step in really understanding the issue, understanding like what are the best models out there and how do we move forward in the North Sound region to increase our capabilities, and what are the right pathways to follow in doing this. And we're not alone in mobile dental, like seeking that option, but hopefully we can all work together and open up more access in the future. Okay, let's go to the next slide. All right, so our projects in 2023, it was a big year. So we committed and dispensed over 260,000. That's the largest amount that the LIN has dispersed to date. And also the first time that we were able to disperse all of those funds in the same year. So I just really think that that speaks to some like building momentum in this area, and it just makes me really excited. So we funded 8 projects. I already told you about 2 of them. Those projects then spread out and like formed a further 29 partnerships. And those are just like direct partnerships. So kind of building that network and that web of folks together. So that is really nice to see. And then if you just look at this little chart, these are the projects that were more service focused. So providing oral health services rather than maybe capacity building. And you can see that through this investment, we were able to put an additional almost 100 days of oral health services into the North Sound region, reaching over 1,100 unique patients in our region. So I think that that's just really exciting. And then if we like drill down a little bit further in how those dollars kind of like pan out on the, I think, right, you see it dollars spent by project. So you can see that here. But what I think is really interesting is that when you look at the dollars spent by anchor strategy, I think there's a clear pattern that is like presenting itself here. And we've already started to talk about it and we will continue to talk about it, but mobile services are just so vital and are an important way to serve people in our region when they don't have traditional access or can't easily make it to brick and mortar locations. All right, next slide, please. And I'm not going to spend a lot of time here, but 2023, as I kind of already mentioned, was really about aligning our strategies. And so, like, in a nutshell, I can say that we want to build collaborations and projects that are sustainable and bring about systems change, all while looking through an equity lens in order to increase overall access to care by deploying strategies around mobile dental workforce and oral health or dental integration. Both of those terms are are great. And our goal is really just to improve health behaviors and whole person health in the region. So that's what we are here to do. And that is kind of a quick way to talk about what it is that we are trying to do here together. All right. And I forgot to mention, if you have questions or comments, please do share them in the chat. I think Keiko and Paulette are just checking on the chat for us. And I did forget to mention them at the beginning. So I'm going to backtrack and just say, I also want to say that this in 2023, I had two coworkers come alongside of me to support this project, which has just been so wonderful to have. I'm a verbal processor, so poor Keiko and Paulette. But now I have folks to talk to about oral health internally. Keiko works with our collaborative action network at the ACH as her primary role. But also supporting the LIN, and Paulette is working with our Medicaid Transformation 2.0 project. And so you will get to know them this year as well. All right, so without further ado, we're going to move from the past into the present, and we are going to turn things over to Alison Mondi, so we can switch present. And Alison Mondi is the policy director for Arcora Foundation, and she's just always a wealth of knowledge as it relates to what's happening and how we can promote policies in favor of oral health. And so time allowing, at the end, we'll have an opportunity to ask questions. But in the meantime, Paulette, can you, or Keiko, can y'all switch the presentation? And Alison, whenever you're ready, you have the floor.
Great, thank you, Lisa, and hi everyone. I'm Alison Mondi. So as the slide indicates, we are really closing in on the end of the 2024 legislative session. We just have 2 weeks and 2 days to go before the March 7th deadline for everything to conclude. As folks probably know, the big priorities for the legislature are passing supplemental budgets. Modifications to the 2-year budgets for operating, capital, and transportation that were passed last year. They'll also consider policy bills, although many of those deadlines have passed. We've already passed the floor cutoff for House of Origin bills. And then I'd say also sort of coloring the environment this year is certainly the upcoming election. So there's obviously, we're in a presidential election year. All of our statewide offices will be on the ballot. We'll have a new governor next year for the first time in 12 years. I think I heard that our governor is the longest governor in office anywhere in the United States right now. So that will just be a big change in terms of obviously gubernatorial staff, as well as probably some agency heads next year. And of course, there'll be all of the House seats and half of the Senate seats will be on the ballot in November, and we'll definitely see a lot of new faces next year. And as folks have probably been hearing about, there are a number of citizen initiatives to the legislature, several of which could have pretty significant impacts on recent policies and taxes that have been passed. Probably most notable in terms of potential impact on the budget is a repeal of the capital gains tax and a repeal of the, I'm forgetting the specific name of it, but it's the sort of the carbon climate bill that also generates a fair amount of revenue for the state. There are 6 total citizen initiatives that have been sent to the legislature. The legislature can either act on them before March 7th, and if they take no action, then all 6 will appear on the November ballot. I think it's recently been reported that that there will be hearings on, I think, half of them next week, which indicates that the legislature might take up some of them. I think that the Democratic majorities are pretty firm that they will not take up the climate or the the estate tax, or not the estate tax, the capital gains tax, and that those will appear on the November ballot. Should those things pass, it would be a pretty significant budget impact next year and in the future. And then I think on my next slide, a review of Arcora Foundation's priority budget requests. I'll also give a status update on some of our partner requests around oral health. So I think we've previously shared with the LIN. We were seeking this year in partnership with many folks at this table and other tables, so an increase totaling $1 million, but split between federal funds and state funds to increase the capacity of local ABCD programs. Both the Senate and the House budgets were released in the last couple of days. This ask was not included in the Senate budget, but it was included in the House budget, which is very promising for continuing to move forward in terms of budget negotiations. And then we also had an ask around community water fluoridation. And this was a small amount of $100,000 to establish a short-term work group to look at the recommendations from the oral health equity assessment that the State Department of Health published a few months ago, which have some high-level recommendations on how the state, as well as public health professionals, can continue to partner with communities around providing accurate information, both around drinking water safety in general, as well as community water fluoridation in particular. So this effort would bring in more diverse stakeholders, so continuing, of course, to partner with DOH, but also providers, as well as community-based organizations and some other folks to really continue to flesh out some of those recommendations and send them back to the legislature. Similarly, it was not included in the Senate budget, but it is included in the House budget, and so we'll be pursuing advocacy to get both of those asks in the final budget. And then on the next slide is a summary of a few asks being led by some of our Arcora's partners that we are very strongly in support of, that also have to do with oral health. So one is $2.5 million to expand the RIDE program, which is the UW School of Dentistry Regional Initiatives in Dental Education. This is training to help bring dental students into rural and underserved areas as part of their education at UW. This was funded in both budgets, which is very exciting and certainly extremely promising for showing up in the final budget. And then two capital asks. One is a component of the Pacific Northwest University's partnership with several FQHCs. Their PNWU is establishing a new dental school that I think should open in a couple of years, and part of their training is co-located with FQHCs. And so some of those were funded in last year's capital budget, and the Yakima Neighborhood Health Services is a remaining ask that they have. And so that was largely funded in both the House and Senate capital budgets. And then the Community Health Center Association has a package of asks for 3 dental clinic projects totaling about $450,000, which also appears in both the House and Senate capital budgets. And so for next steps in terms of all of this, on the operating budget side, the House and Senate budgets will be exec'd by the Ways and Means and Appropriations Committees tomorrow. That's where they'll consider amendments and take votes on the full budgets to send them to the floor. Probably a few days later, the full Senate and House will consider their operating budgets as well as the capital budgets. They'll consider amendments again. There'll be many floor speeches. They'll vote on the full budgets, and then budget writers from both chambers go into closed door negotiations where they hash out a final unnegotiated operating budget as well as a capital budget. And this is something I track less closely, but and a transportation budget as well. Those budgets will be released probably in the we are essentially close to the final days of session, but in the very final days of session for final votes off each chamber floor and to be sent to the governor for signature. So I would say, especially in this coming week, is an important opportunity for advocacy in terms of thanking legislators for things that have been funded and asks that priorities get included in the final budget that they negotiate. Those are my main, before I transition to another related topic around advocacy, those are my main updates on where we're at currently and what's still alive in the legislative session. As I mentioned, we were past cutoff for bills to be voted out of their chamber of origin. So we've seen a lot of legislation not make it past various milestones. So there aren't currently any policy bills, I think, that we've been supporting that are still alive this session. But if there are other questions or things that folks wanted to point out, wanted to leave some space for that.
Does anybody have any legislative related questions for Allison? You can just come off mute or put them in the chat.
I have a question.
Yeah.
Go ahead.
This is Cynthia from the North Sound ACH. I was just wondering, is there anything that we can do to get a message to our legislators?
Yes, great question. So I am working on, I think especially for the couple of asks that are only funded in one of the budgets, an organizational sign-on letter to send to budget writers and the folks who will be doing the negotiations, asking that they basically fund at the House level in the final budget. And so I'd be happy to share. I should have that in the coming day or so. Just share that with Lisa, perhaps to share around with this group. Obviously, it'll be an opt-in basis, and also recognizing that everyone has different jobs and maybe you can't sign on. But for anyone who is interested in joining the letter, I think that would be wonderful to have as many folks as possible.
Great, thank you.
Yeah.
Anybody else have a question?
So I have a question. This is Kate Foster. I am wondering if there is a website to kind of track some of these healthcare, oral health and other initiatives in terms of funding that's coming up for renewal or being considered in the legislature?
We should probably update our website and put some of this information on there. If anyone's ever reviewed the state budget process before, the budget bills are like more than 1,000 pages long. It's everything that is funded by the state. So it's actually pretty tedious to go through. But that is something that we could put some summaries on Arcora Foundation's website and share that link around.
And we can also, we have another newsletter coming out in March, right at the beginning. So maybe I can connect with Allison and ensure that some updates happen there as well.
Oh, great.
Yeah, I think we have time for another question if anybody has anything. I have a question for you since we had a little moment of silence. I know this year was like the second year of the biennium. I believe you shared that with me. And so is it true like next year is more likely a year where we can think more creatively around like policy changes we might want to bring forward to the legislature? Can you maybe talk a little bit about that?
Yes, and that's actually a great segue. I did want to put in a plug for doing more work with the LIN over the interim around policy development. So yes, you're exactly right. This session is only 60 days. It is the second year of the biennium. So also bills that were introduced last year that did not pass were alive again this year. It's the second year, and new bills were introduced. But the deadlines are just so fast. In a short session, I think there were only like 3 weeks for all policy bills to be both heard in committee, amended if there's going to be amendments, and voted out. So, I mean, right out of the gate, a lot of stuff just doesn't make it through. It's hard to introduce new topics that legislators are unfamiliar with in a short session, especially because there just really isn't a lot of time, and they're often keeping an eye on things they introduced last year that didn't make it and trying to get those things through. So I would say the interim leading up to a longer legislative session, and then the long legislative session, which is still only 105 days, but feels quite long, compared to a short session, is really the time, to bring forward, I'd say both, new or bigger policy asks, as well as, I mean, it always depends on the revenue environment and the budget environment, but in general, larger budget asks, it's never easy to bring forward, but it's easier to bring forward in a long session where they're, doing the full biennial budget rather than making modifications to a budget they've already passed. And so that was, I think, something I know we've discussed with some folks around this table, and I think wanting to use some of this interim to continue to talk with the LIN around, and if there are folks perhaps interested in joining a work group or subcommittee around developing a policy agenda to help advance some of the LIN's goals, and I think around some of the things, Lisa, that you were talking about earlier. Also, I think there's a lot of expertise around the table as well as probably areas of opportunity in terms of learning and seeing what folks are already bringing into the conversation, and where we can tap into folks' expertise in terms of policy and advocacy, what would be helpful in terms of training, and then working to develop a policy agenda for the LIN and setting up some conversations during the interim, which I think are really the best opportunity in terms of both getting to know legislators as well as having a little bit more time in meetings to be able to provide more background and context for why you're bringing a policy proposal or budget ask forward. 'Cause meetings during legislative session tend to be really, really short. But yeah, so I think that's something that we can continue to, I would love to continue to talk about with this group. And yeah.
Did you have another slide, Allison?
I did want to just give a quick update on Linden and community water fluoridation.
Okay.
So for folks who know Stacy Torrance at Arcora, she wanted to make sure I put in a plug for work that's happening up in Linden. And I think as everyone has been updated previously, the city council is, I think, pretty seriously considering rolling back community water fluoridation there. And so, and the timeline is there will be a hearing where they will collect public comment on the matter on May 6th. And so I think in the meantime, really interested in, local advocates from the community who are willing and able to reach out to the council and, sending letters or emails, folks who might be willing to write letters to the editor or op-eds, and or attend that May 6th meeting and provide public comment in support of continuing community water fluoridation. That would just be really helpful. And I know if folks have questions or ideas, you can reach out to me or to Stacey or Lisa, can obviously connect us as well. And just, continuing to beat that drum and see, we turn folks out in support of that.
Awesome. Thank you so much for being here, Allison. I know you're very busy. It's always nice to get an update from you this time of year.
Yeah, thank you for having me.
Yeah, for sure. And as Allison alluded, we would like to do some advocacy this year with the LIN. So we'll talk about that, how we might do that a little bit later. But I want to now turn things over to another Arcora funded program in spirit of National Dental Children's Month. Heather Gallagher is the program manager of access at Arcora and the ABCD, access to baby and child dentistry. You would think I could say that since it's ABCD, is one of those programs. And so, Heather, thank you for being here, and go ahead and share your screen. You have co-host privileges, and we can't wait to hear what you have to share with us.
Thanks. All right, let's see if I have tech issues or if we're gonna do it. Can everyone see my slides, hopefully in slideshow mode? Wonderful. Well, as Lisa said, I'm Heather Gallagher. I'm with Arcora Foundation. I'm a senior program manager there, working on a lot of things access related. But my role primarily here today is State Managing Director for the Access to Baby and Child Dentistry Program. And so let me get this to work here. So I thought I see a whole lot of National Children's Dental Health Month backgrounds, which is exciting because I wanted to share a little bit about that as well. So for those who don't know, February is National Children's Dental Health Month, and we have lots of resources for folks if they're doing outreach to families, if they're providing services, and those can be accessed at the ADA's website. Their theme is Habits for a Healthy Smile. They have downloads like printable posters, activity sheets, tips for families. They're free for anyone who is interested in accessing those. Additionally, we're doing some other things through the Arcora Foundation. So we have provided small grant funding to the local dental societies so that they can do outreach around Children's Dental Health Month. And they're doing pretty much all sorts of different things that work best for their communities. So I've seen some of them are going out and doing tooth fairy experiences. Some are going to early learning and talking about good oral health habits and book reading. And then others are doing fun things like providing tickets to a children's museum for children who are eligible for ABCD. And so, yeah, they're doing lots of fun things, and we're trying to track it through the hashtag NCDHM. So if you are on Facebook or other social media accounts and you're posting around Children's Dental Health Month, please feel free to use that hashtag. You can tag the ABCD program. We'll follow you and interact and hopefully get a lot of people excited. In addition to the funding to dental societies, we are also doing a lot of spotlights on social media. Some of our local program coordinators for ABCD have gotten write-ups done in their newspaper, and we're trying to share them out to everyone. I'm pointing out, I put the picture there of Lauren Spillis, who many of you probably know, but this is an article in her local paper talking about how she partnered with the dental hygiene school. And they went and worked with early learning to talk about oral health access and show kids how to brush their teeth and do all sorts of fun activities with them. Another piece we're doing for National Children's Dental Health Month, this is a brand new relationship, but the ABCD program is partnering with Dolly Parton's Imagination Library. And so we got a little too close to February to make this fully formed, but our hope is that we can partner with all the local coordinators and do some work around brush book bed. And next year, hopefully around February, we can really highlight some of the successes from that. And then last, Alison stole my thunder. We are advocating for local programs to get much deserved, needed, and extra funding to continue to run their programs in the best way they can. So that's my highlights on those, but I thought since it is Children's Dental Health Month, I would talk about dental health for children in Washington State. So as you can see here, the number of children enrolled in Apple Health has been steady over the past decade or so. We've had a 1% increase in the last fiscal year. And with the rule change of kiddos being able to stay on Apple Health, regardless of that eligibility process until the age of 6, we expect that this might actually grow or probably just bits. We don't expect like a huge spike, but we do have more kiddos enrolled. And so between fiscal year 2019 and 2022, you can see we had a bit of a dip here. This is the utilization, so kiddos accessing the dentist. And the reason for that dip, of course, is COVID. Everyone had some decreases in access and utilization, but I do want to point out that we are starting to trend upwards. And remember, a fiscal year, even though it's 2022, it's 2021 is in there as well. And so we're not really seeing what the full landscape looks like quite yet. I do also like to point out that while we are slowly climbing upwards, that 47% actually includes more children than the year before. So it's a bigger growth. So across the state, as you can see, utilization is around 47%. And so I like to point out that the North Sound region over here, pretty close to the average, and a huge shout out to San Juan because there is no access there and they're still really holding on and doing the best work they can. So I can't tell if Kristen's on here, but clapping to you. Again, nearly 4,000 additional children were enrolled, and we wanted to point out that Adams County's had the highest utilization at around 64%. They've done some really great innovative things. They've used teledentistry. During the pandemic, they really worked hard to make sure that families were being reached out to, and maybe they couldn't go to the dentist, but they still got those oral health messages. Garfield County has the lowest utilization at 28%, which is not surprising because the entire county has one dentist. So yeah, they're really working to increase access there and hopefully get some more providers. And then I point out Stoughton County because even though it's tiny and also pretty much a dental desert, they had actually the highest increase in percentage over the next fiscal year there. All right, and then if we look at trends, so even though we're at 47% still trying to climb up, Washington children do still have better access to dental care in comparison to the national average. So for kiddos under the age of 20, the national average is 45, we're at 51%. You can see that trend pretty much continues. Under the age of 2, we're about even, we're a little bit lower, and that is an age group that ABCD is really focusing on now, trying to make sure that message is out there that first tooth, first birthday, that these kiddos are getting into a dentist, not when there's a problem, but because it's part of routine healthcare. All right, so what is ABCD? I see a lot of coordinators here and I almost want to stop sharing and just have them tell you, but I will continue on my path here. ABCD is a system of care that connects young Medicaid eligible children to dentists that really are trained to see them, and they have support through their local community. The Access to Baby and Child Dentistry program was actually established in the early 90s as a pilot in Spokane County. This came about through work from local dentists, partners, including like health jurisdictions, child advocates, and the University of Washington. Their goal was to increase access to dental services for Medicaid eligible children through the age of 5. And now, just so everyone sees the breadth of it, it goes through the age of 12 if a child has a DDA indicator. And I point out the background of ABCD and its origin because I see a lot of similarities with the local impact networks. So this was a community, they saw a problem, they came together, they worked across the hall from each other, and they really brought about change. And so they made a huge difference in Spokane, but long-term, it made a huge difference across the state. So ABCD is a public-private partnership. The primary partners are the University of Washington School of Dentistry, Arcora Foundation, and the Healthcare Authority. But we are also partnered with Department of Health's WIC program, with the Washington State Dental Hygiene and dental associations, with local programs, with health jurisdictions, pretty much anyone who serves young children, we want them in our partnership, and we will work together to make this program work for everyone. In addition to ABCD, Arcora has other public-private partnerships that really work hand in hand to make access happen. And so you all know about Mouth Matters. I saw Madeline hop on here. But Mouth Matters is really the medical arm of ABCD, and Madeline goes in, trains physicians and their staff to look into children's mouths, to do family oral health education and provide fluoride varnish, and hopefully also a referral to a dental home. And again, we've got ABCD, Mouth Matters, we're all telling families the same message. So they're hearing it from multiple trusted sources. We also have Dentist Link, which is a free referral platform for anyone in the state of Washington who has Apple Health or no insurance at all. And our database can help folks find a dentist that will see them in their community. We have a data share agreement with the healthcare authority, so we know who's billing Apple Health. The hope is that then we can curate lists so that people aren't calling and hearing the word no. They're finding the place that is actually going to see them. People can access Dentist Link on their own, total self-serve, or they can call and speak with one of our referral specialists who will work more closely with them to find the care that they need. All right, and like I said, ABCD started off local, but it is a statewide system now, and it's in all 39 counties. We've got about 25 coordinators across the state who really work to make sure that the program is working for the communities they're in. The program's goal is to ensure that positive dental experiences in early childhood will lead to a lifelong practice of good oral health. This is done in part by identifying and removing obstacles to early preventative treatment, such as lack of transportation or language interpretation needs. So like I said, we have 25 program coordinators covering all 39 counties. I say some of these here, I think that's Melinda Nan, who's Snohomish County, or she was the coordinator at one point. And they receive coaching and training from the public-private partners to help do outreach and really make sure that kiddos are getting good oral health messaging and getting into care. In addition to these coordinators, we also have 48 dental champions. And so these are typically pediatric dentists who have volunteered their time to train other dentists in access to baby and child dentistry. They will also work with the local coordinator to do presentations at dental societies or go out in the community and talk to families. All right, so what does an ABCD coordinator do? I like to tell everyone they do absolutely everything. This list doesn't even scratch the surface. So really they work with families to do coaching, talk about the importance of accessing early preventative dental care. And then they can also help with light care coordination, helping families make and keep their appointments. In addition to that, they also connect with other organizations that serve young children, and they really try to focus on those that are serving kiddos under the age of 2, children with special health care needs, and then those who are working with Black, Indigenous, and communities of color. We want to make sure that trusted voices are echoing the message across the state. In addition to all the things they do with families, they also work to recruit new providers into the ABCD program, and they maintain relationships with current providers. They are usually the front line when they hear that there's an issue with, say, how a claim is working, or if a provider hasn't been paid correctly. They are the ones telling the healthcare authority and telling us, so we can go work with them and make sure that they feel supported in serving children with Apple Health. All right, and then how to access ABCD. Well, I like to remind everyone, children do not have to enroll in ABCD. If they are under the age of 6 and they have Apple Health, they have ABCD. And the same with kiddos 6 to 12 who have a DDA indicator. So like I said, kiddos have it no matter what. Dentists, on the other hand, do have to be trained and certified. And I said just dentists, but dentists, hygienists, and medical staff. And so this training really teaches them how to work with a family, how to work with a young child, and how to give that anticipatory guidance and family oral health education. To access a local program coordinator, you can visit our website, which is abcd-dental.org. I did a little screenshot of the top of our page. If you just click on Find a Dentist, you'll find a local program coordinator. If for some reason the right person doesn't come up, you're welcome to email me and I will help connect you. And then last, if you're working with families that need to find a dentist, maybe they all want to go to the same place, so a pediatric provider isn't the right place, you're welcome to use Dentist Link to help find a place for them to be seen. And with that, I will see if there are any questions. My email's on there. You're welcome to email me and I'll stop sharing.
Okay, I think we have time. We have about 3 minutes. So if anybody does have a question for Heather, we could hear that now. You can just come off mute or put it in the chat.
Say, I counted about 6 ABCD coordinators, so if I can't answer it, you all can.
Heather, I will just put a question forward really quick. I've been curious, like how the ages for ABCD got determined. I noticed that, school age children could really benefit from these same types of services. And could you maybe share a little bit about why the age groups and if there's a hope to expand or ability to in the future?
Yeah, so that question comes up all the time, and actually we had to do a bunch of research to figure out why was 0 to 6 the number. And so what they really originally, they had to have some kind of parameter to start with, and funding, of course, was important. But what they thought was 0 to 6, they felt like all of the primary baby teeth were in, and that there weren't any adult dentitions starting yet. And so that's what we've been told. I'm sure there were many other factors that went into it. As for expanding the age, it's always a topic for us. We hear from providers, we hear from families that it would be great to have school-age children included in the set, or at least up to the age of 12. What we in the public-private partnership have decided is at this point, we are really going to focus on the already eligible children, because only 47% of them are accessing care. And then our hope is if we can increase that access, then we can advocate to increase that age as well.
Awesome. I can tell you've answered that question before.
If I could add, I think one thing that I didn't hear you mention, Heather, is that a key part of the healthcare authorities part of the partnership is that they enhance ABCD. They pay dentists a higher rate for ABCD dentists. And so that's the real crunch when it comes to establishing the age, would be coming up with the revenue to pay at that higher rate for that many more kids.
Yeah, Laura is exactly right. And so there would be a whole process of figuring out fiscally what would that cost, how many children would that be. We've made a good first step with including the children with special healthcare needs. So hopefully going forward, it will be an easier ask.
Well, thank you so much for being here. We, like you, will be endeavoring to start the celebrations next year a little bit earlier as well. But, we didn't want to miss the opportunity to highlight this month in oral health. So thanks again, Heather.
Thank you for having me.
Okay, well, while we get it's already up there. So we're going to move from the present to the future now. And I'm going to give you a little bit more information about what is to come this year in the network before we turn it over to some other folks. But when I think about the LIN, I think about kind of 3 different primary components. And so we have the projects, we have the network, and we have the evaluation. And so I would like to just kind of begin by starting with the projects, because I think that is where what a lot of people like to hear about. And you can go to the next slide. I wanted to share, so we're always kind of like a year behind. So in 2023, we received 180,000. So the numbers I shared with you previously was 2022 funding for work in 2023, and this is 2023 funding for work in 2024. So at the end, in the fall of 2023, we went through our proposal process, and allocated our funds for projects that officially began January 1st of this year. So we definitely had less funds this year. And again, we're kind of seeing that similar trend where mobile projects are coming to the forefront and workforce. So just high level, what projects that we have right now are the second year of our San Juan School Sealant project. And this was a partnership between the San Juan Community Health and Community Services and the Community Health Center of Snohomish County. They were really working on this proof of concept. Can an FQHC from another county help San Juan to get the access to providers that they needed so that their kiddos could get the dental services? And so we had a very successful first year. We're moving into year 2 and likely the last year of this project because the outcomes are just proving to be quite positive. Our other school sealant project has been with a longtime partner, Best Dental Help. We approved a project to expand their services to an additional 3 schools, and they're really focusing on the recruitment of those schools in Skagit and Island counties, just because those counties don't have other programs that we know of operating in those counties. And I just want to say, I think it's been 3 years now that we've been partnering with Best Dental Help. And 3 years ago, they had 0 schools here in the North Sound region. And I believe they're up to 19. Lauren, I see you, so you can correct me in the chat if I'm wrong here. 19 schools, and that equates to like thousands of kids. I'm pretty sure it's over 2,000 kids that they are serving. So it is pretty amazing the quick growth that we've seen in our region with Best Dental Help. And then we also approved a mobile dental project, another one in San Juan County. And this one, we have been working with mobile services out there through the LIN for several years, but this is a brand new project. So they're really undertaking also kind of this proof of concept and seeing if they can use more non-traditional settings. So existing dental clinics in off hours, community rooms with portable equipment on the 3 main islands to see if that could be a sustainable way to provide dental services in those counties. So we're really excited to see how that is going to go. And, you know, if we see some positive outcomes, it could have really some broad reaching implications for how we can deliver mobile services throughout the entire state, really. And then we have a little placeholder here because we have another mobile program. It's pending. We're kind of just redesigning the program right now with the participants, but hopefully we'll be able to announce that really soon. And then we are starting our second workforce project with Futures Northwest in their Learning with Leaders program, and they're providing experiential career exploration. So they're partnering with both Skagit Valley College and Bellingham Community College, hosting an event at each, 2 workshops at each, where students will get to learn about careers in oral health, dental careers, and also get the opportunity to roll up their sleeves, you know, try placing a sealant. What is it like to like clean teeth, that kind of thing. So I think it is going to be great. They already hosted one of their workshops, so we're excited to see how the second one goes. All right, next slide, please. And And of course, I mean, Mouth Matters is getting a lot of love today. So Madeline is out there. You can scroll through and see Madeline. Because it's just so important to train our health providers, our physicians, and obviously this program has really focused on pediatrics, but as I shared with you earlier, Madeline has come in, taught residents at Skagit Valley Hospital. I know she trains other providers, but it's not only training the providers. They also help work with the administration to make sure the electronic health records are set up, to prompt those providers pathways for billing so that they can get reimbursed for those oral health services, education, and whatnot that they're providing in a non-dental health space. So if you know people who would benefit from this type of training, you can always reach out to Madeline. And I'm sorry, I did not put her information on here, but I am also happy to connect you to Madeline. And we just really want to have the North Sound be the area that has the most trained providers in the state, because it's a really great and not too costly way to increase access to oral health services across the board.
And
All
Lisa,
right.
thank you for the promo. And I just put my name in my email.
that's
Sorry, I'm off camera because I'm not well today, but
Well, thank you for
please
being
do reach
here.
out. Yep.
Yes, Madeline is great. So do reach out to her or myself and we'll get you connected. All right, next slide, please. All right, so from the projects to the network, one of the things that we're really trying to do is strengthen this network that all of us belong to. Traditionally, we've held 1, maybe 2 general meetings a year, and we're really trying to bulk that up here in 2024. So obviously, today's February 20th. We're having our virtual meeting and we know the theme, we're moving through time. This year in probably late May, and we're going to get a date really soon, we hope to host our very first in-person general meeting. And we're kind of calling it like walk through the data. We have an exciting data project that Lara has been working on. She'll share a little bit more in just a moment about that. And so we want to share what Lara's been doing it all. She has been collecting, and we want to get everybody involved in how we can do the final packaging of this data so that we really understand what's happening in the North Sound region when it comes to oral health. And then in the fall, we'll host another meeting to kind of like close out our year, and we'll share that once we get that date pinned down. All right, I think the next slide. All right, and so other ways to engage. So I alluded this earlier, we sunsetted our steering committee because we were talking about like service more than strategy and so on and so forth. And we thought, hey, we need to like open this up and get more people involved. So what we're proposing is to create some key areas based on this like interest that has bubbled up and energy that we're seeing in the community around workforce and mobile dental. These are anchor strategies, as I've shared before. And so what we're thinking for these are they're like probably geared more towards specific people who are kind of working in that area, maybe workforce, they're part of a university like training program, or guidance counselors, or other people who support career development and exploration. Mobile dental, again, like it might be a provider or a organization that develops health-related services or community organizations that may be able to partner to help bring services to their community and act as that trusted messenger. And based on what we heard from Alison, she has so kindly offered to be that guiding hand if there are a group of us who would really like to put our heads together throughout the rest of the winter and spring and decide what could be really beneficial for the LIN to prioritize and bring to the legislature in the future. So advocacy could be open to anybody who has time, interest, and wants to participate in discussions and building a platform. And finally, our review committee. And so one of the functions the steering committee did was review proposals, allocate the budget, so on and so forth for those proposals. So we want to open this up and say, hey, if this is something that you're interested in doing, providing some constructive feedback, making sure that proposals align with LIN priorities, then we want to open that up and make that an option for people who want a little bit deeper connection with the network. And then obviously you can tell I love to talk, so let's talk one-on-one. So if you want to talk about, brainstorm ways that maybe you or your organization might be able to elevate oral health or implement initiatives, or you're thinking of a project you might need some funding for, I would love to have a conversation with you. So I have my email right here. Do not hesitate to reach out at any time and we can get together and have a nice chat. Okay, I think that's my last slide. And what we're going to do now is turn it over to Lara. And Lara is going to share what this expanded evaluation is going to look like in 2024. So Lara, welcome, and we'll turn it over to you.
Hi, everyone. Great to be here with you today. I'm excited to be joining the work of the North Sound LIN in this evaluation capacity. There's kind of three main activity areas that I'll be working in. The first is evaluation of the network. The second is evaluation of the projects that the LIN has funded for this year. And then the third area is what we're just kind of calling an oral health environmental scan for the North Sound region. And I'll give a little bit more information about each of these areas. Can move it to the next slide. Thank you. So for the network evaluation, this is basically a continuation of the evaluation that's been done in prior years, working with somebody else. I'm forgetting Natasha. You may have had interaction with her. And the goals of this chunk of evaluation is really to understand how the LIN is functioning as a collaborative network, and looking at both what's working well and how it could be strengthened. So this is done via a survey of all network members, as well as key informant interviews with a much smaller number. This will be done late spring and into the summer, and this is just my plug for ahead of time. When you get the survey, please complete it, because it really does make a difference. The number of people we have responding. More people, obviously, it just gives us a much more robust understanding of the range of perspectives and the overall sense from all of you about what's working well and what could be improved. So that's the network evaluation part. The second piece is project evaluation, and really here we're trying to understand the implementation and the impacts of the LIN funded projects. So we'll be collecting information from the project leads on some of the basic numbers, number of people have served, types of services provided, some demographics from those served, and then really trying also to get at what have been some of the challenges and successes related to the three network pillars: collaboration, systems change, sustainability, and also successes and challenges related to advancing equity in oral health. So there'll be twice a year reports with both quantitative and qualitative data, and then some conversations with project leads. And I will say that Lisa and I have held project launch meetings now with the 4 funded projects. And even ahead of time, before their projects have even started, we've just had some very fruitful conversations with some important learnings and around their projects. And I will underscore that the real, the undergirding for this project evaluation is learning. It's learning what are some of the challenges and barriers, how might those be overcome, what other kinds of partnerships or resources or policy changes might make a difference in moving this project or a related project forward, that kind of thing. So this project evaluation will be happening throughout the year with a report at the end that will kind of summarize both the numbers, some of the quantitative information, but then also these successes and challenges and learnings. As I mentioned, the qualitative aspects of the project reporting is based on the network pillars, as well as that equity overlay, so collaboration, systems change, and sustainability. Lastly, this other chunk of evaluation is, as I said, what we're calling an oral health environmental scan. And really, what we're intending to do with this is to identify the areas of greatest oral health need in the North Sound as a way to understand where the LIN can or should direct its resources to advance oral health equity. So this isn't evaluation in the true sense of the word, in that we're not implementing something and then evaluating it to see how it went. It's just to gain a deeper understanding of where the needs are, the greatest needs are. We know there's needs throughout the North Sound region. And the methodology here will be to retrieve and collect data on a range of indicators, and I'll show you a list in a minute so you have a better idea what I'm talking about. But to get these at a sub-county level, so a zip code level, or maybe census tract or school district, county level data is fairly accessible, but we know there's a huge range of access and other kinds of contributors to oral health status within a county. So we are really going to be trying to get these data at a sub-county level. And then we'll be taking this data, Lisa and I are still learning about how this data mapping works, and we'll need to bring in some additional expertise, but we'll map this data so we can see what are the areas of the greatest need. So there might be an area that doesn't have any dental providers there, and that is a high portion of low-income community members, and has no community water fluoridation, and doesn't have a school sealant program. Those kinds of things sort of stack up, and we start to see, oh yeah, this is an area that could really use some additional attention and focus and resources. So the time frame for this will be really for, through the fall. And we will collect data and present it first. We'll be doing some sharing out at the May meeting, which Lisa mentioned, for just kind of a snapshot of where we are with the North Sound now. And then there'll be some conversations about potentially building out something that would allow us to see changes over time, more like a dashboard. We're not sure about that part yet. TBD. Next slide. So these are indicators that sifting through a wide variety of things, and we're able to see these data already exist. It looks like most of them can be retrieved and stratified or separated out by a sub-county area, like a zip code or a school district. And looking at all of these together, or as many of them as possible, is what will give us that picture of areas of greatest need. As you can see, I'll just say, as you can see, some are about the context of the community, some are about what the availability of dentists and dental providers are, and some are about the access or the actual utilization of services, and some attempt to directly or indirectly measure actual oral health status. So I just want to say a couple last words about kind of the big picture of evaluation and kind of putting these pieces together. So LIN projects, the four for currently funded ones are listed here, those for 2024. These all contribute to advancing the LIN's anchor strategies, the mobile dental, workforce, oral health integration. And next slide. And then those strategies drive toward the outcomes that we want to see, which are increased dental care capacity, especially for underserved populations, increased dental care utilization, more people getting dental services, and then increased practices of oral health and preventive behaviors. Those in turn drive towards kind of our North Star goal, which is improved oral health status for everyone in the North Sound and reduce disparities in oral health status. So there's a link between the projects, the strategies, and then these longer term outcomes that we want to see. And the data mapping part will give us some insight into these longer term, the intermediate and the longer term outcomes. So I hope that wasn't too much evaluation jargon, and I welcome any questions, comments, concerns, ideas. Shout out.
I have a comment.
Please.
I'm new to this meeting. I work at the North Fork Library. I'm with the Whatcom County Library System, and I'm very passionate about oral health because I've been dealing with it all my life. I had to have my first root canal at age 11, and I was lucky to get that service because my parents paid a lot of money, and this was a huge amount of money for them at the time because we were recent immigrants, but they chose to go ahead and get that for me and eventually a crown. And if I didn't get that, I might not have had the job that I have today, because as we know, our smiles impact us at interviews and the kind of work we're able to have. And I've personally known people who got rejected even from a really bottom level landscaping position because there was a tooth missing and it was really obvious. So I'm super, super passionate about this. Jessica at the Resource Center out here at Maple Falls mentioned this group, and I'm just so thankful for all the work that all of you do. And I referred quite a few people to the mobile dental van. A lot of the people that I've helped sign up have problems that have been ongoing for so long that, you know, a simple cavity a simple thing won't fix it. A lot of these are root canals or extractions or crowns. And I would just love for everyone to be aware that it's badly needed in our area and lots of other areas. Lots of people that I know travel overseas, travel to Mexico to get dental care, or not ignore, but aren't able to get it for many, many years. So, and then also educational piece about children, because sometimes 2.5 years old, my dentist told me that cavities run in families, and my family's one of these families, unfortunately. But fortunately, I'm here in the US. And I think that education piece that yes, your baby has one tooth, but please go visit the dentist is so, so important. And any way that we can help get the word out or get these surveys out, I would love to help.
Great, thank you. And there was a little conversation happening in the chat about book, bath, or bath, book, bed, and libraries would be a great part of that if it were to come to pass. I saw another hand up
Lara,
earlier. Yes.
We are running just slightly behind. So if people have questions, please put them in the chat and we will definitely get answers for you. But just to stay on the time here, sorry, I'm going to turn it over to Paulette to introduce our last speaker of the day. But you all will be hearing much more from Lara throughout the year.
Thank you so much, Lara. That was great to hear about. So my name's Paulette. I'm the Health Integration Specialist here at North Sound ACH. I'm going to help us transition. So part of my job as the Health Integration Specialist is to work on the Healthcare Authority's Medicaid Transformation Project 2.0 in the North Sound region. A section of the waiver focuses on expansion of community-based care coordination and other expanded Medicaid services for community members preparing to leave county jails, prisons, and youth detainment centers. So as Lisa's previously mentioned, growing mobile dental services in the North Sound region will be a major focus of the LIN in 2024. Our next presenter, Dr. Jessica Dubek from DentALL Consulting and Services, recently began a mobile dental service to the Whatcom County Jail. And this demonstrates the type of service that could be implemented more broadly through the waiver. And we're thrilled to have her here to present on the mobile dental clinic serving the Whatcom County Jail. And I'll go ahead and share your presentation as well.
Sounds good. Thank you. Well, thank you for having me. Yes, as mentioned, I'm going to be talking about the mobile dental services at the Whatcom County Jail. Next. I established DentALL about 6 months ago, and our mission is to bridge the gap in dental access by using innovative methods to deliver high quality care to individuals who face barriers to dental services. Next. Wanted to give you guys a little bit of background about Whatcom County Jail, the services and the population that we are serving. So the services that are provided, medical, and that includes a medication-assisted treatment program, behavioral health, and a reentry program. There have not been dental services for about 3 years. So you can imagine the backlog is pretty significant at the facility. There's about a 50 to 70% of patients that have substance use disorder, and the broad range varies from population that is housed. Nearly all patients housed at both the work center and jail have untreated dental decay, and very few patients have a dental home or have seen a dentist within the past year. And I'm going to touch on this later in the presentation. For most individuals, dental treatment within the jail will be their only treatment available to them. And a couple things that we have noticed, number one, on top of not having a dental home or not seeing a dentist, is within a week, they are experiencing dental pain due to untreated dental decay. Here's a close-up of some of the equipment that we're using that I'll go over later. We started treatment in September. just this past year, and we are there 1 day a week for 6 hours and have completed a total of 19 treatment days. Next. So when we got this contract, you know, the facility, I don't know if anybody has done a tour or a walkthrough, but there is not a lot of space for anything. So we really had to be creative. And I think that is one thing with a mobile setup, you have to be creative. So some of these pictures on the far left, that is where they stored all of the paper charts. They are now electronic, but it was kind of just a catch-all room. And so we turned it into a sterilization and dental supply room. In the center is where the nurses' stations are. In the very back of the picture, you can faintly see there's 3 doors, and then there's another door that you can't see. And that is where patients are waiting until they see other medical or dental. And then I'm going to touch on that a little bit just to walk you through a typical day. That is the nurse's station. And on the far right is our dental suite. It's very minimal, but we are able to get a lot done with very little. So I will go over all the equipment here shortly. Next slide. So just wanted to kind of broadly go over equipment and costs. I will note that Whatcom County had a chair that we were able to fix up and refurbish to make it work. And then they also did have an autoclave. That is a pretty big ticket item, so we were able to save on that. So roughly, you know, you're looking at about $63,000. And you know, that does seem like a big number. Dentistry is very expensive, as most of us know and are aware of. But to compare that to the referral costs from 2022, talking to the nurses, just to give one example, the referral cost with one clinic that they contracted with, and that's only just, this is one clinic, was $84,000. And that's not even taking into account the nurse's time to find an office and schedule, the deputy's time to get the patient, transport the patient, stay on standby, then transport them back. So there's definitely additional costs within that one referral cost. And that was just, again, one office. Next slide. So the population is about 250 to 300 offenders that are being housed. The services that are being provided, we are doing comprehensive exams. The jail is accredited and so required to do an annual exam for patients, anybody there longer for a year. Limited exams, we are doing fillings, extractions, and then general treatment includes denture adjustments, post-ops, etc. So as of February 7th, we've seen about half the population and really in that 6-hour day, try to go through as many patients as possible. I have a very effective team, and we really rely on the nurses and deputies to help keep that day, keeping it like a good flow. Next slide. One big thing that I keep in my toolkit, really stress preventative measures. With consent and confirmation of allergy, we do an iodine scrub with every patient and a fluoride varnish at the end of every visit. This helps suppress the bacteria that is commonly associated with tooth decay. My team and I go through MI, which is motivational interviewing, and oral health hygiene instructions. They do have minimal tools available to them, but nonetheless, they do have a toothbrush, toothpaste. So we really try to go through that and review that. One thing that I'll be adding to my toolkit is SCF and Rivistar, which I'll talk a little bit on the next slides. But prevention is just huge regardless of whatever community you are serving. And we really have to incorporate that into our treatment. And this is just some of the small ways that you can be effective. Next slide. So this just arrived today, actually, so I get to use it on Thursday. SDF, if there's any dentists in the room, we're all aware of SDF on how it can arrest decay. Down the kind of negative, I think, effect is it does turn your teeth black when you put it on a cavity, or even enamel that is white in color, like decalcified. So the one thing about SDF is putting on front teeth is not something that a lot of people want to do. I did just learn about Rivistar, did some research about it, and it does not stain teeth, but you can put it on the front teeth to kind of help slow down that process. Next slide. Another big thing that we're using is Onset. Onset is a buffering agent. I deal with a lot of infection in jail, and this helps at least with the front teeth, kind of your premolars on, to get numb when there is an infection. Molars, back teeth, not so much, but this does help. A lot of these patients are on antibiotics for infections, and so versus keep on that antibiotic route, we try to just get the source out so they're not having to take antibiotics. So this is a really great thing to keep in your toolkit for those infected teeth. It also provides some comfort when you're numbing it up and doesn't sting so much. Next slide. So a typical treatment day. I work with a nursing team throughout the week. They'll give me a call. I am on call for them. And we will talk about patients who either need to be on my schedule urgently or they can triage. So I do depend on the nursing team to develop my schedule each week. The deputies are a huge part of the day. Our day is 100% dictated on transport and safety. Those 3 doors that I mentioned in the picture, they are playing Tetris in a sense of ensuring the right patients are going in the right room to wait. We can't mix males and females or certain populations to prevent from fighting. So we really have to ensure that deputies are taking patients in and out. And again, it's just kind of playing Tetris to ensure they're in the right space to be seen either by medical or dental. We see an average of 7 to 10 patients a day, depending on treatment and transport. And again, each patient will get an iodine scrub, varnish treatment, MI, OHI. Everything's electronic now, so charting and imaging, which makes things go a little bit faster. And again, deputies and the nursing staff, such a huge part of allowing me to do what I do to be productive. With it being only a 6-hour day, we try to really get through as many patients as possible just because of the backlog. Next slide. I went through that really fast, Lisa, because I know you said you were down on time, but these are just some of the references. If there's any clinicians on this to reference, the Rivistar that I was able to find from my own research, but also some iodine and fluoride varnish on how that can be effective to reduce the germs that cause tooth decay. This is also a book that I would just recommend to everybody to understand addiction a little bit better. I do believe that we can kind of broaden our views of what addiction is, being a disorder, and help folks kind of get back on their feet. A lot of my patients, every time I see them, I ask them the same 2 questions. Do you have a dental home? And when is the last time you've seen a dentist? And it ranges out of those 160 patients that I've seen. I've had 1 person say they have a dental home. And a lot of them feel embarrassed. A lot of them feel like they don't have the means to see a dentist. And so this is a huge service to allow a lot of these patients with addiction or not addiction to get back on their feet. So cannot recommend this book enough. It is a good eye opener to have a different mindset of what addiction is. And next slide. And that is it. Lisa, hopefully I got you some time, but here's my email if there's any questions, and I am definitely open to questions now if we have time. I know I went through that quite fast, but yeah. Just
Thank
open it
you
up.
so much, Dr. Dubek, for
Yeah, you're
sharing.
welcome.
We really would love to give everyone up an opportunity to ask some questions. I do see one in the comments asking, I didn't see fillings on the list of services. Are those provided?
I listed it as operative and just said fillings. We do fillings.
Does anyone else have any questions they want to jump in or share in the chat? Okay, well, I do have one prep because I was curious. Has there been any interest from other jails or carceral institutions within the Norristown region in replicating this model?
Yes, budget cycles are pretty tight, so you kind of have to hit right at the right budget cycle in order to incorporate these services into their medical system. So there is one site specifically that's interested, but they've already gone through their budget, and so yes, there are others that are interested, just unfortunately due to budgets, kind of have to abide by those.
Absolutely. Lara, did you have a question?
Yeah, Dr. Dubek, so fantastic the work that you're doing. And my question is, what do you think it would take to replicate in a non-jail setting, some other kind of community setting, with, doing this in a school or a church or a skilled nursing facility or some other place?
Yeah, so my previous, we were able to do this. So I was previously to this, I was a dental director at Lummi Nation. And we were able to set up a mobile clinic within Lummi Nation School, serving K through 12. And it's very similar to what this setting is. So, if you have a sink, you're able to have a small autoclave, and you can really, you need a certain amount of space to house everything, but as long as you're able to be flexible, and I think that is so important to have that mindset when delivering these services, is being flexible. And things may go awry, but just kind of go with it. So we were able to do it at Lummi Nation School, and it's still going and very successful. In a church setting, you would need to have some place to kind of house sterilization equipment. I think that's going to be your biggest issue, because the mobile cart that was pictured can wheel anywhere. The X-ray machine and sensor and laptop can go anywhere. You can get a chair pretty easily. I just was at the Seattle King County Clinic this past weekend, and just, they simply had something similar to a comfier lawn chair. So you can really get creative in providing these services. Sterilization is just the one thing that you will have to put some thought into, in a sense, making sure everything is being compliant and staying compliant.
Awesome. Thank you for that. We do have Colette who raised her hand.
Thank you. So a question I had is, Dr. Dubek, have you been part of any of the conversations relating to the Medicaid Transformation Project 2.0 waiver with the Reentry Demonstration Initiative and the pre-release services being provided within the carceral facilities?
I have not. I read the document, and it's there's wiggle room if DentALL is incorporated that in the language and how you interpret it. I was not a part of that, but after working there, a handful of months, it does allow a lot of these patients, when they do re-enter, to have a different level of confidence. One example is, I had a patient, she was there for a couple of months, but she needed all of her teeth out. She was determined to get back on her feet, knew she needed dentures, and just simply allowing her to save those costs of doing a full mouth set of extractions so she can start taking those next steps really boosted her confidence and determination. The last time I saw her, right before she was released, she's like, I have housing now, I have a social worker, I am clean. And it's these small little steps that people just need help with, that you can't. Navigating healthcare is very complicated, and a lot of these patients need help.
Absolutely.
Oh, can I just,
Thank you.
hey, Paulette, Lisa,
Yeah.
I kind of also wanted to comment on Paulette's question, because Dr. Dubek and I have had many conversations, but one of the things about the MTP 2.0 waiver is that it doesn't call out oral health specifically as one of those health-related services it's looking to expand. So, one of the things that we are internally at the ACH really talking about with our fellow coworker grant writers is pulling together a small group that could put together, for lack of a better word, like a white paper on why oral health needs to be one of these services that's included in this paper. So more to come on that. I just wanted to take the moment comment that we're thinking about it and trying to take action on that very point.
Thank
Thank you, Lisa, for that connection. Absolutely good point. I heard the passion in your voice talking about your last patient, but we do have a question that kind of relates to that, wondering what spurred the interest in serving this patient population?
You know, I am not maybe your square typical stereotypical dentist. I definitely, public health is a huge passion of mine. As I said, as I alluded to, I mentioned, I was a dental director at Lamination and able to work with populations that struggled to get quality care was a really big driving force, not only in that community, but surrounding communities. My husband is in addiction medicine, and you know, he would come home and share stories of his patients have pain. These patients have pain, and a lot of them go back to using, or how do you fix this pain, or they can't find a clinic. And then this opportunity just kind of happened, and I jumped on it as fast as I could, and hopefully I'm helping patients, you know, stay clean, because really patients stay clean, they get to go back to their families, and they get children get to be back with their moms and dads. And I just think that's so meaningful, even if it's like just simply fixing a tooth.
Absolutely. Thank you so much for that and for sharing about your program. We're very excited to support it.
Thank you.
So ending on that high note, if you're interested in learning more about the importance of providing dental services to systems involved and incarcerated people, check out this article that Keiko has shared in the chat. And then I will turn it back to Lisa to adjourn.
Okay, wow, thank you for hanging with us through 2 hours is a lot, but hopefully there was a nice mix of information, and after our initial tech problems, I think it's been flowing pretty steadily. So just before we adjourn today, I also alluded to this earlier. We are going to put a link in the chat, and I am going to ask you to please open it right away. Don't even wait. And what this is an engagement survey. So we are still forming what the re-energized LIN is going to look like in 2024, but the LIN is a network, and so it's made up of all of you who are passionate about oral health, or not yet as passionate as some of us about oral health, and so we want to get you involved. We are updating our membership list so that we can be more targeted with messages. And this little quick survey, it should take you less than 2 minutes, is just going to help us to organize our information a little bit better, know when we should reach out to you, what types of information or even potentially work groups you might want to participate with. So I'm going to ask you to fill that out either as I'm talking now or right at the end of the meeting. We'll also send it out with the follow-up email to our meeting today. So be on the lookout for that. I mentioned this before, but our next newsletter is coming out in March. So please do look for that. And we already know we're going to have a legislative update on there. So thanks for helping to form the newsletter. And also we'll be sending out the date really soon for our first in-person meeting in May. We really, really hope that you will take a bit of time out of your busy schedules to come together in person, talk about oral health, look at data, eat some food, and just kind of build our relationships and strengthen our network. And so I just want to say thank you. I also want to do personal thank you to Dr. Dubek. We have such amazing oral health advocates in the North Sound region. I just love everybody I get to meet and work with. And so whenever I meet a very passionate, high energy person, I get excited because that is kind of how I am. So anyway, thank you all for joining today. Thank you to all the presenters, and please do reach out with any questions that you might have, and we will see you all very soon.
Thank you, Lisa.
Thank you.
Take care.